Welcome to On the Beat, everyone. I'm Troy Thompson. Today I'm joined by Dr. Stephen Yarborough and Tony Falk from Louisville Dental Associates, and we want to talk all about implants and what they are and why we may need them. Welcome back to the show, both of you. Nice to see you. Doctor, I want to talk to you a little bit about implants to begin with.
Right.
Explain to everyone at home what an implant is, and are there different types of implants?
Yes, there are. There are different types in a sense of lengths and shapes of them. And what an implant actually is for lack of a better word, a screw with a receptacle for an attachment, which could either be a crown, a single tooth, or you could have a couple of them and have some fixed bridge work hooked to it. Or a lot of times we use them to help with retention of removable prostheses such as dentures and partials.
And that's what I want to talk to you about, Tony, because you're the in-house lab technician. And that's one of the reasons why Louisville Dental is so popular, because not only are you making everything inside the house, basically the business, that it makes it a lot cheaper for the patients as well. When you are making the implants, what is it that you're looking for behind the scenes once you're making them?
Well, I'm looking at the lip line. I'm looking at chin, the distance between the chin and the nose. That's absolutely very, very important. Also, I'm looking and asking questions concerning about the habits and lifestyle of the person, because that is a big determining factor in what I'm going to make and how it's going to function in their lives.
I want to piggyback off that. Now, let's talk about oral health care when it comes to people having implants, especially when you can have a full set of dentures done. Now, they have the traditional type, which is possible, okay, which you do there, but you also have the screw-in. And I hope I'm saying that correctly, screw-in dentures or placement?
We actually, more than that, do the kind that are actually snap-in.
Oh.
And so it just makes for easier hygiene. It can actually be snapped out and the patient can clean and take care of brushing and washing and taking care of their denture as well as the implants.
Back in the day, we all saw grandma pop them on the side of the table in a glass of water. Is that still happening?
Probably so, Troy.
No, but I mean nowadays with the latest technology.
Some people wear them at night, some people don't. Most of our patients are able to remove them at night if they would like to. We recommend they probably keep them in, especially if they're implant retained.
Tony, I want to talk about implants when it comes to maintenance, cleaning them, and what is important when coming into your office to discuss what type of implant is available.
Habits.
Right.
Habits is number one. Tobacco use. And expectations is number two. Because you can want something, but you can't have what you want. You have to, there's a fine line between want and need. And you have to decide what it is do I want and what it is do I need. And that's where Dr. Yarborough and I assist the patient in that. And of course, cleaning, it just goes back to making sure, I like the dentures that you take out so that you can have better hygiene.
Do you give them options of what is possible within their budget?
Yes.
Okay,
Yes.
Talking about budget, do implants get covered underneath your health insurance?
No, not to my knowledge. Now, some insurances are beginning to cover some implants.
Just starting, yeah.
Just starting to do it, but as a rule of thumb, I would have to say no.
What do you say to people who, you know, may not be able to take that commitment of having an implant done? How do you work that out for them?
Well, generally with us, Troy, usually starts with the patient. Actually, if we're talking about denture retained by implants, it starts out with them wearing a denture and seeing how they do with that.
Yeah.
If they're having trouble with retention or the denture staying in and out, and if they need the extra help, we drop an implant.
I appreciate both of you. Thank you so much.
Thank you, Troy.
If you want to find out more information, there it all is up on the screen for you.